Here we go. Stand by. Anytime.
Why did you become a breast surgeon?
I became a breast surgeon because I like my breast patients more than I think any of my other patients. You get to continue to see them year after year, and you get to build strong relationships with them. So I think you help them through a very hard time, and then you get to continue to see them and build those relationships year after year.
So within those relationships, what do you enjoy the most about your job? Talk to me about that.
The things I enjoy most about my job and the relationships that I build with patients are the getting to know people on a more personal level. So it's not just taking care of the patient because they have a certain disease. It's getting to know them and taking care of them completely. 360, taking care of the patient completely. That doesn't make any sense.
I'm going to give you, from the top.
Okay.
And relax. It's just a conversation between you two. Okay?
Okay. All right. So you want me to start?
Yeah,
Okay.
I
I am Dr. Tallheimer, and I am a breast surgical oncologist.
One more time without looking at the lens. Keep your eyes
I
on.
know. I keep.
We're not here.
My name is Dr. Tallheimer. I'm a breast surgical oncologist.
Here at Houston Methodist Hospital.
Okay, I'll do it. All right. My name is Dr. Tallheimer. I am a breast surgical oncologist here at Houston Methodist Hospital at Willowbrook.
Okay, almost. Houston Methodist Willowbrook Hospital.
Okay, I'll get it at some point.
And anytime.
My name is Dr. Tallheimer. I am a breast surgical oncologist here at Houston Methodist Willowbrook Hospital.
Very nice. Okay. That feel good? It's just her. We don't exist. Yeah. Okay. Bye.
So why did you become a breast surgeon?
I became a breast surgeon because I love my. I'll try that again. I became a breast surgeon because I like taking care of my breast surgical patients. I find with those patients, I develop stronger relationships with them over time, and it has allowed me to be more fulfilled in my career.
Okay.
What motivates you to get up every morning and come and see your patients and speak to them?
I'm motivated to get up and come to work every day by my patients because they are appreciative of what I do, and their appreciation of me helps me work harder, and I don't know what I'm saying. All right, try that again.
Think about it for a sec.
I'm sweating.
Love the interaction with the patient.
Mhm.
Yeah.
It's
I know.
about relationships, and
Yeah.
in that way you're bonding with them. It's more than just you come talk to
Yeah.
me and you're out.
All right.
Anytime.
What motivates you to come to work every day?
The things that motivate me to come to work every day are taking care of my patients and building relationships with them.
You start right there.
I enjoy taking care of my patients. I enjoy building relationships with them. I enjoy being able to treat them as a whole person and not just a disease. So to me, patient care comes first, and that includes more than just treating the breast disease that they see me for. That involves making sure that they have emotional support, social support, that if there's anything that we can do to help take care of them completely, that we're able to do that.
Very nice. I like that a lot. We got.
If as a woman, if I come into your office and I've received this diagnosis, what's my next step? What when I see you, what's most important? What are you really trying to say is what's most important on your end as far as when you make that contact with the patient after she's received that diagnosis?
After a patient has received a cancer diagnosis, I think the most important thing is that the patient understands what that means for them. And then once they've understood that, we can move forward. They're in the different steps that we need to take. That would be different for everybody based on their diagnosis, but making sure that they understand the root of the problem, and then the steps that we need to take moving forward is what is most important.
At what point in your life did you decide, hey, this is what I want to do?
I decided that breast surgical oncology was what I wanted to do about halfway through my general surgery residency. I felt very unfulfilled by a lot of our patients that we would see once or twice and then never see again, whereas our oncology patients, even other types of oncology, we would continue to see them year after year and build stronger relationships with them. I've always been interested in women's health, and breast surgical oncology seemed like a very good fit for me, where it was something that I was already passionate about, and I could combine my passion for women's health with my passion for my oncology patients.
That was good. And, you know, what's different about that answer? Okay.
You want to redo the passion?
No, go ahead.
Okay. Step back first. So with your passion and just you wanted to be a part of that, you wanted to be a part of that change, why did you choose Houston Methodist Willowbrook Hospital?
I chose Houston Methodist Willowbrook Hospital because I was very impressed with their
Regroup it.
I chose Houston Methodist Willowbrook Hospital because I was impressed with their philosophy on putting patients first. When I interviewed here initially, I felt that everybody that I met was very kind and compassionate. And then talking to everybody further along as in my interview process, I realized how important patient care is for Houston Methodist Willowbrook Hospital.
Say that last part again. I realized how important. Go.
I realized how important patient care was for Houston Methodist Willowbrook Hospital.
Let's do that again, and you just don't move when you say
Okay.
realized. Go.
I realized how important patient care was for Houston Methodist Willowbrook Hospital.
Okay, very nice. Stitch that together. He does. I don't edit anymore. Right, darn it.
Because we covered values and compassion and Methodist being aligned with your values.
What are some of the
So-
procedures that you commonly see for patients that come in to see you?
So when a patient comes to see you, describe to me some of the procedures you perform. How do you treat patients?
The procedures that I perform depend on whether I see a patient for benign or malignant disease. For malignant disease, I cover a large array of procedures that can include a lumpectomy, where we take a small piece of breast tissue for a smaller tumor, up to a mastectomy. I do biopsies, lymph node biopsies. For benign breast disease, that changes a little bit based on what the disease process is.
Okay, let's do that one more time.
Yeah.
Because we just went through a list of things, so you're having to recall. Hit it. Anytime.
The procedures that I cover depend on whether the patient is seeing me for benign or malignant breast disease. For malignant diseases, I keep saying, sorry, start over.
Deep breath, relax, settle in,
All right.
look at her, and go.
The procedures I cover depend on whether the patient is seeing me for malignant or benign breast
Let's
disease.
do that again. Did you make that face? We can't have that on video. Okay, anytime.
The procedures I cover depend on whether a patient is seeing me for malignant or benign breast disease. For malignant disease, I cover from smaller procedures like a lumpectomy all the way to something like a mastectomy, and we also have the ability to use our plastic surgeons for reconstruction. We also have the ability to take smaller tumors out and do breast reconstruction with your own tissue, I'm sorry.
It's okay. Same with smaller tumors, you can start there.
Okay. I'm trying to think of where it was.
We're talking about breast reconstruction.
Okay. So with smaller tumors, we have the ability to reconstruct the breast with your own tissue, and we can also use the plastic surgeon to help reconstruct the other side to match. So a reconstruction on the cancer side, as well as a breast reduction on the side that's not affected by cancer. We have the ability to remove the breast completely and reconstruct that using tissue expanders or your own tissue. We have the ability to sometimes spare the nipple and keep this entire skin envelope so you have looks the same on the outside as it did before. And we also have the ability to remove the breast completely and do no reconstruction depending on what the patient feels most comfortable with.
Talk to me about that role that you play, because when you're working with the plastic surgeon in the womb sparing, that's a part of who she is. It's a part of her identity. But you play a major role in that because you're helping to, in some ways, give back that confidence that maybe, with the diagnosis, you have a lot of emotions going on. So your role in helping a woman get to that next part in her journey is what? My role in helping a woman get to her next step in her journey is really to guide her. So I have the ability to present the options that are in front of her, whether that's a lumpectomy, a mastectomy, a nipple-sparing mastectomy, a mastectomy with reconstruction, without reconstruction. It's making sure that she understands all the different options, the risks and benefits to each of those options, and then help her make that decision. It's not up to me to make that decision for her. It's for me to educate our patients so that they can make an educated decision that is best for them. Because what's good for one patient isn't necessarily good for another patient.
I like that answer a lot better than I liked the one previous, going through that. Have you met with Dr. Echo, that patient who has this fear of finding a lump? Or if they've been told by their general practitioner, you need to go see an oncologist, this doesn't look good.
When you get when you are home, no, that's not what I want to say there. Sorry. I've got to think about the great way to phrase it.
Well, the question that kind of goes along with the other doctor videos, it's when should I find a lump?
Patients should come to see me anytime they have concerns about their breasts. So that's men or women. If you find a lump, if you find that you're having a discharge, a lot of times it's more expeditious to see a breast surgeon first because we have the expertise in that area and are able to differentiate whether that's something that needs further workup or something benign that we can watch.
Okay. Now, when you tell them, when someone has their initial diagnosis, them through something that's going to be probably one of the most difficult things that they're ever going to go through.
After an initial diagnosis of cancer, I make sure that my patients understand the disease process completely. I find that having an initial diagnosis, patients typically stop listening once you start talking. So I try to give drawings and handouts so that you have reliable information to read once you're home. And then I make sure that my staff and myself are available for questions once you get home and let all of the information sink in. I would much prefer a patient call and speak to me about their diagnosis than get on the internet and start reading things that may or may not be reliable information.
Oh, that's great. That's good stuff right there. Now, talk to her about it. The problem with researching things on your own.
Sure. The problem with researching your diagnosis on the internet is that it's not always reliable information. There is definitely a bias towards people blogging about their negative experiences and not their positive experiences. There are some reliable websites on the internet which I am happy to give out to patients. There are reliable websites out there which I do give to my patients. However, I prefer that they use the websites that I recommend instead of looking on their own and finding information that way. I also like to be available, both myself and my office staff, to answer any questions that the patients have so that they're getting reliable information, and I know that the information that they have is what I want them to know.
Maybe so the information that they're getting is completely reliable.
Okay.
Related to their specific diagnosis.
Okay. So where do you want me to start?
And just pick that up.
Okay.
And mainly, I want people to know that they can call me and my staff so they get reliable information instead of from the internet.
Right.
That is specifically in tune with their specific diagnosis.
Mainly, I would like my patients to call the office, to speak to me or to my staff, and get reliable information that's specific to the type of diagnosis that they have. There are so many nuances in breast cancer that it's not one size fits all. So it's important that the patient is getting the correct information, and I feel that they're best served by calling and speaking with either myself or anybody in my office that can answer those questions appropriately.
My philosophies,
Kind of
that was
covers
one
it.
of them.
My philosophy regarding patient care. That's more. We'll do that one second. So we'll do the one when patients, they can come here to Houston Methodist Willowbrook Hospital and get a complete spectrum of care, and your role in that.
Patients can come to Houston Methodist Willowbrook Hospital and get patients can come to Houston Methodist Willowbrook Hospital and get complete care. It is nice because it's located in the community, it's close to home, and it has all of the conveniences that a larger center could also provide. However, you get more of a community feel, and I think that helps patients feel more comfortable and satisfied because they're less of a number and it's more personalized.
Very nice. Very good.
Patient experience.
What's your ultimate experiences having you as their physician?
My ultimate goal for the patient experience is to make sure that the patients feel like they are a priority. Having been on the other side of medical care, I know how frustrating it can be when you don't get return phone calls and you feel like you aren't being taken care of well. Try that again.
Or haven't been heard, or.
Okay.
I like where that was going.
Yeah, I forget how I started that, but my goal in the patient experience is for the patient to feel like they come first. I want the patient to feel like they're a priority for both myself and my practice, and I want them to feel like they can call and speak to myself or someone in my staff anytime that they have questions or needs. My ultimate goal is that, sorry.
My ultimate goal, look at her.
My ultimate goal is that the patients feel like our office and the entire staff at Houston Methodist Willowbrook Hospital are, sorry, my,
It's
okay.
It's a team effort.
yeah,
You, your staff, the patient,
Right.
it's a team effort towards the decision, the diagnosis, the treatment.
yeah.
Yeah.
You want me to just start there?
My ultimate goal is having
My ultimate goal is that the patients feel like they're a priority, that they can call myself or my office staff at any time and feel like they are going to be taken care of in a timely fashion. Here at Houston Methodist Willowbrook Hospital, it's a team effort. So everybody here is invested in making our patients a priority and making the experience as
and making an experience.
as
easy, as comfortable as possible.
and making the experience as easy and comfortable as possible.
We need to do last minutes, our effort
Yeah.
hitters.
Let's do that one more time. My ultimate goal.
Oh my gosh, okay. My ultimate goal is that the patients feel like they are a priority, that they can call myself or my staff at any time, and that we will take care of them like we would take care of our own family. Here at Houston Methodist Willowbrook Hospital, it's a team effort where we take patient care and make that our priority over everything else.
stuff you can tie in there, cut it? Okay, very good. I think we got